collaborative. So today we have the great pleasure of hearing from Laura Clark and Kendra Morgan, who have been involved with a really fascinating project on opioids. Oh yes, that problem still does exist. Is a number of conversations I've been having this last week as well around the opioid issue, and it'll be interesting as we get into the conversation today. I'm sure many of you are focused on that as well in your own work all across the country. And what a number of quite a while ago, we when we published our playbook on opioids last year, we had the good fortune of getting to, I'm not quite sure, I can't remember exactly how we intersected with them on the public library's work, but I was totally fascinated by the work that they were doing and learned so much about libraries, which I'm not a frequent user of, and just the amazing work that's going on and the incredible resource that became very obvious to me after we had a chance to talk with them about it. So I'm really delighted to have them here talking a little bit about it. It's a very comprehensive program, and I think very exciting to many of us. An important time to actually focus the conversation on this topic, so as not to lose sight of it, especially in light of the potential downstream impacts of COVID on the SUD population. So if you can advance slides, we're got a couple of different people here. Great. So some housekeeping. As I said, you're probably all familiar with the Zoom already. So there is, although it's slightly different than a WebEx or a GoToMeeting, so you can find the navigation tools along the bottom or the top. And I just noticed a new little button down there about reactions. So they're adapting here. So I guess you can do a thumbs up or whatever. Along that, you have a participant list, and you also have a chat button down there. And most of you have already used the chat button, so we'll be using that as we go forward. We would like to have as much conversation as we can today around these topics. I know it's a near and dear topic to many people who are involved in this work. So chat is a great way to do it. Raise your hand. You can do that as well, and/or as we progress through the conversation, just break into the conversation. And as we all know, although I think people are accelerating their capacity to actually have conversations online, which is great. It's really, unfortunately, one of the benefits of doing this work here. We record the session today like we've done all of them in the past. So you'll find, I don't know how many, 25 or so of them on the NIC Hub site. And if you haven't signed up already, there's the URL, hub.nic-us.org, and if you sign up, you'll get communications from us about upcoming webinars and other things like that. So I don't need to belabor that. So if we can advance one, great. Thank you. So our agenda today is pretty straightforward. We're going to actually just want to talk a little bit about some of the topics that we have before diving into the topic, into the actual presentation. We'll talk a little bit about the NIC and a new initiative that we're launching here that is hopefully generative in terms of integrating all this material here. And then we'll turn quickly and spend the bulk of the time with Laura and Kendra talking about the program here. So if you could advance another slide, that'd be great. One note about upcoming webinars. We have a pretty full agenda through the beginning of May right now. We will not have a call next week on the 10th, Good Friday, but we do have some ongoing presentations over the next 4 or 5 weeks that will be, we'll get back to them, and you'll be seeing more notifications about them on the newsletter. But the week of the 17th will be the a deep dive into the FAST, the fire accelerator overview. And then, as you can see here, we'll be talking with Soma about the WIN measures, which is a fascinating national project that comes out of the 100 million healthier lives. And then we'll have actually a gallery, Insights Interoperability Gallery. This was something that was going to be done during the State Health IT Connect Summit, which was canceled. So we'll be actually having an online session with a number of major initiatives, the Gravity Project, Da Vinci, Karen Alliance, and Project Unify. So that will be a slightly extended webinar and should be very exciting for folks. And then we're going to come back to the opioid crisis with presentation from the folks from the Agency for Healthcare Research and Quality, or ARC, who are doing a bunch of deep dive on this work. So we're continuing to come back to some of these topics as we go forward. And as I said, you'll get notification of that. Next. So very briefly, NIC is the National Interoperability Collaborative. It's a community of networks. The main thing, I think many of you have heard me talk about this before, although if you're new to it, maybe not. This is a Kresge-funded initiative that we've been working on for a couple of years, and the idea is to really work across domains. And this is a subject I never get tired of talking about, which is how do we think broadly, both within our own lane, but how do we keep our eyes open and really work towards connecting across to public health, education, public safety. And I think all the more, both opioids really expressed the need for that. And of course, COVID now sort of explodes the need for sort of situational awareness and the impact of all these initiatives on the work that we're doing. And so we're dedicated to that idea of looking at both going deeply into each of the domains, but then also working to cut across those domains and do more synthesis and synergy. And that's articulated in the document that's off to the right side here that we did about a year and a half ago, 2 years ago for HIMSS, that talks about the similarities and some of the challenges and opportunities between those domains. So that is something that we're going to be coming back to over the next 6 months in preparation for our action agenda. Next slide, please. So just 2 slides and we'll move into the presentation here. So I was on a call yesterday and there was a discussion around social determinants. And one of the things we were doing was talking about some of the challenges and opportunities. And it occurred to me yesterday during that conversation, as well as over the last couple of days and weeks, that COVID has really happened, that this is, and I don't use the word lightly, this is truly a paradigm change, right? This is not an incremental change where there's an issue, I mean, opioids in particular, ravaging the country, 180 or 200 people a day are dying in some instances, big problem. However, it's kind of was manageable in some ways with enough resources within our space. This is a whole different thing. This is, as we all know, it's somewhat saying the obvious, but in the conversations we're having, it's really striking to me and many people as it's growing is that we're at whether or not you call it an inflection point or you're talking about literally a paradigm change in terms of how are our systems at the local, community level, nonprofit, state, city, region, and the nation going to respond to this, where we're seeing so many fractures and so many chasms of the ability to, I mean, just go shopping for that matter, no less sharing information around and help bringing resources and attention and effort and support to people who need it all across the spectrum of care in every community we have. So it forces that question, forces that thinking about how do we think more broadly? And this is the time to do it. And one of the things that we're now focused on is this idea of an action agenda. And so I think most people have already heard or seen reference to this Wayne Gretzky quote, which maybe he said it. I'm not sure if that's urban myth or if actually he did say it, but it's good metaphor, which is, where are we going, right? We know we're in the midst of hell right now. And the question is, where are we going to be in 7, 8, 9, 10 months? And so what we're doing as an organization and what we're inviting people into is this idea of looking out at that point, looking out for January 2021, and beginning to create this action agenda, learning along the way, so that as we're proceeding, we're gathering knowledge, we're looking at the challenges, we're really trying to assess what are the challenges that organizations and systems are facing, so that we can begin to develop an action agenda to make recommendations to figure out how to do this interoperability work more effectively going forward. Because with the inflow of dollars, resources, and the obvious need to figure out how to do social determinant work more effectively going into the future, we think we can contribute to that conversation. And we think we can do that by bringing together the various sectors and domains. And that's what we're going to be doing, as I said, as we go forward. And so these webinar calls are going to be focused more and more on how do we define that, capture our knowledge, and then document that in ways that we can contribute to a national agenda. It's an ambitious goal, but it's one that I think is really readily important. And I invite you to participate in that. So if you can advance one more slide and click down twice. So this is just a definition. These slides will be on the hub when we get off of it. So for those of you who are interested, this is really a collective effort, which would be informed by research and experience to develop what should we be doing next, right, as these things begin to coalesce. And so over the next year, as I said, we'll be pulling together subject matter experts from each of the various domains and bringing that together into a cohesive, coherent action agenda. And we welcome your participation in that. We've set up a spot on the hub for people who want to learn more about it and who actually want to engage in that discussion, contribution, research, and you'll be hearing a lot more from us about that. And so we invite you into that. And with that as a sort of a precursor, we can go to the next slide. Hopefully I've got this right. There's the hub. Next slide, please. Let me turn our attention now to the presentation at hand today on the libraries. I want to introduce Laura Clark and Kendra Morgan, who will be our chaperones today, so to speak, helping share what you've learned and facilitate some of the conversation. We invite you to participate in it, again, through chat and through raising your hands, and I will undoubtedly interject into the conversation, as I hope many of you will, as we go in to make this really useful information with that. So I know we got a little bit of a switch here in terms of presentation and control of the screen. So hang with us for just a moment here. And I think we are there. Miracles. Perfect. Okay. I see it on my screen, so take it away.
Excellent, excellent. Well, welcome everyone. I'm Lara Clark. We thought it would be helpful to start with a little introduction about our respective organizations and how we came to this work. I work with the Public Library Association, which is a division within the American Library Association that is solely focused on public libraries. The ALA also represents and works with K through 12 school libraries and college and university library staff, as well as library advocates. So for those of you that might intersect with school or higher education, we also have folks that work in that space in libraries. PLA just celebrated our 75th anniversary, and we have about 10,000 individual members from libraries across the country. My work particularly focuses on research and strategic initiatives and partnership at the national level, and I'm joining you from Chicago, which is where PLA is based.
And hello, everyone. My name is Kendra Morgan, and I'm a senior program manager at OCLC. OCLC is a global library cooperative with, it's a nonprofit with almost 18,000 members worldwide. And I'm part of our research and membership division. And a lot of my work focuses on providing access to continuing education, primarily to public library staff, but we work with staff from all library types. And I've worked on several projects around health and supporting individuals with particular needs around employment, so helping to train libraries to respond during the economic crisis during 2008, which we anticipate seeing more of that happen, and then work around helping libraries to support individuals looking to apply for the Affordable Care Act when that rolled out, and then the opportunity to work on this project with Lara, which has been great.
Thanks, Kendra, and thanks again to all of you for joining us today to talk about public libraries and their partners working to strengthen their communities during the opioid crisis. Of course, right now, we're also finding ourselves in the midst of the coronavirus outbreak, which represents a very new and challenging experience for all of us in libraries, and I'm guessing for most of you. We'll think about this as we go through today's session, and we expect you'll see some alignment between these public health crises and perhaps some ideas to carry forward as we seek to inform and serve the community. As I was learning more about Nick in advance of our presentation today, I was struck how our shared interest and commitment to networks and collaboration. I hope our presentation today will further those connections to address social determinants of health and well-being. And thanks for inviting us to join you. Under normal circumstances, public libraries are buildings that are open to all, including those who may be in crisis and looking for a safe space. For this reason, library staff are finding themselves on the front line of the opioid crisis. Library responses to this issue have included providing information on prevention, treatment and recovery support, and training staff on the facts, as well as how to use naloxone to help reverse opioid overdoses. These images on the screen now are all from libraries that are helping to respond to the opioid crisis in a variety of ways. This includes hosting and supporting recovery groups, author talks, and public awareness campaigns. Beyond these specifics, though, it's important to note that libraries support the public in addressing health-related topics in so many ways, as Kendra mentioned earlier, and it's certainly true for PLA, and I'll throw some links up in the chat later. And that's certainly part of the conversation as we also prepare, as we are in the midst of dealing with the coronavirus. As we look at the bigger picture of libraries supporting community health challenges, this quote is from a report on the Healthy Library Initiative, which is a partnership between the University of Pennsylvania and the Free Library of Philadelphia. The library offers many different programs and services to the community connected to health. And the report notes that there are two particular strengths that libraries offer to advancing healthy communities: accessibility and trustworthiness. These two assets are important to keep in mind as we go through this session. Think about supporting people who are facing mental health issues or substance use disorder, and this could be the individuals themselves or their friends and family. As organizations that are seen as both accessible and trustworthy, this presents a tremendous opportunity for libraries, for our communities, and for our partners. Most of what we're going to cover today comes out of the research project Public Libraries Respond to the Opioid Crisis with Their Communities, which is a partnership between OCLC, which is a global library cooperative, as Kendra mentioned, and the Public Library Association, which is a professional organization, and is funded by the Institute of Museum and Library Services, which is our federal agency for libraries. We've connected with libraries and both local and national organizations like Nick interested in partnering with libraries, and we've also learned more about responses to the opioid crisis and the important connection to our overall responses to substance use disorder and to mental health. We thought it would be helpful to start by touching on three overarching goals of this effort to set some context. The first is that we want to help public library directors and staff to make informed decisions about strategies, policies, and activities. Taking what we learn from the experiences of others and then promoting their lessons learned to strengthen the efforts of others. Second, libraries are largely overlooked when it comes to organizing citywide responses to the issue. The project aims to raise awareness among the key sectors and organizations involved in formulating strategies and interventions that public libraries are a key local partner. And this is part of the reason why we're here with you today. This session and being with all of you is a great opportunity to increase the awareness. And finally, for issues that are as broad and complex as the opioid epidemic, a library trying to go it alone might work in some cases, but partnerships and collaboration can help extend resources and impact further and faster. So this project was designed to highlight strategies that take libraries out of their silos and visibly working with community partners to achieve aligned outcomes. The development of relationships and infrastructure that can support changes and needs is something that can live well beyond a single project or activity. How do we invest in infrastructure that can benefit us all in the years to come? So to the polling question that we were talking about, we have a few audience interaction pieces. So we'd love to hear from all of you about when was the last time you used your local library. Do we have response options, Kendra?
Yep, they're going to be pulling up a Zoom poll for us. So we'll share that out with everybody.
Cool.
We may. Not yet.
Yeah.
So tricky. This technology. Or you can also tell us in the chat if the poll doesn't come up. I think we had just a range of options in terms of, you know, last week, last month. Do you remember, Kendra?
It was 3 months, 6
Uh-huh.
months, last year, or you're not sure. And this is, you know, we're just kind of curious if people have been going recently, and it's perfectly fine. There's no library shaming here.
I don't know. Speak for yourself. I'll try and
Oh,
follow
you borrowed puzzles.
Kendra's good lead.
James
Yeah.
borrowed puzzles. I know that those are a hot commodity right now,
That is
getting
for
into some
sure.
puzzles.
That is for sure. Well, I am thrilled to see any library, university library, school library, particularly if you have kids, public library. Thank you for responding. And it was so funny. One of the first responses was October 2019, which is really specific. I wonder if it was a Halloween program or anyway, this is great. Thank you all for sharing your stories. And it's true, there is no shame. We know lives get away from us. And hopefully at the end of today, you'll be like, hey, I need to go back to my library. It's been too long. Oh yeah, until it closed for the crisis. Yeah. That is true. Although if you have not been to your library online, now is a great time to check it out, since we know that all of you here have probably, unless you're calling in, you have internet access. There's a ton of stuff libraries are doing online. All right, keep talking in the chat. This is really, it's fun to hear from all of you. I'm going to talk just a little bit more about the project before Kendra dives into some of the specifics. So we had 4 big buckets of work to do on the project, including the creation of research-based case studies, a series of cross-sector discussions, which is how we became familiar with the NIC community. We have recently released a call to action paper to really synthesize what we've learned and encourage libraries to engage in opioid response work if they're not doing so already. And finally, the dissemination work, sharing the project findings, and that's something that really has spread out across all of our activities. Most of the findings and resources that we'll be covering today are available online. They're available for download and sharing, and we encourage you to check them out. We're really proud of the work of libraries, as you might imagine, and what we've been able to capture in this research. So my lovely colleagues at OCLC are making it really easy with the URL oc.lc/libraries-opioid-crisis. And we'll put that link in the chat as well. As we start to dive into the heart of this discussion, we thought it would be helpful to share some information about the reach of public libraries, particularly for those of you outside the library sector, which I think is probably all of you today. The federal agency, the Institute of Museum and Library Services, helps to collect and aggregate information about America's public libraries. And here are just a few of the statistics that speak to the reach of our libraries. More than 5 million programs every year. These are all annual statistics. 118.6 million people attending those programs. More than 258 million public access computers, which we know are often used to research health questions and improve people's diets and nutrition. Libraries are open more than 36 million hours, and we host more than 1.3 billion visits every year. And that's in our physical building. We don't have national statistics for our digital resources, but we're hearing that those are leaping forward right now. As we start to look at the research and explore the findings, I wanted to share this quote from one of the interviews. Am I off the slides? Oh, good. Thanks, Kendra. I wanted to share this quote from one of the interviews that we conducted with libraries and the community partners in our work. At the core of this problem is the fact that people in our communities are dying from opioid overdoses. And that concern is something that we have heard as we embarked on the journey for this project. And there's also the impact that this has on the family and friends, the people who love this person who is dealing with substance use disorder or has died from an overdose. What became evident as we conducted this research is that yes, the opioid crisis is a national crisis, but it also represents a community-wide problem and it requires community-wide responses. So I wanted to spend a little time looking at how we did the research and the libraries represented in the research before Kendra shares the actual research findings. The case study research enables in-depth data to be gathered for the purpose of learning more about an unknown or poorly understood situation. For this project, we explored the local conditions that led the library to responding to the crisis with community partners, how and with whom the response has been implemented, what the results have been, and how those have been measured, and what have been the opportunities along the way, as well as challenges, needs, and future opportunities. There are many libraries across the country that are doing some form of opioid-related programming, but we were looking for diversity in both the types of programming and the communities that they serve. These are just some of the factors that we considered when selecting communities to study. Here are the sites that were studied. These locations range in size from around 16,000 people to over 800,000. As noted in the previous slide, these libraries represent a range of different resources, different library infrastructures, and different communities. The fact that these examples represent a range of community interventions is also important. The case studies represent a variety of partnerships that came with different strengths and capacity. Our goal was to show that this can take many different forms and can be helpful to libraries and communities with different needs, and there isn't a single way to do this, that each location needs to and should create their own path. And here's a high-level view of what we heard in relationship to the partnerships at the local level. As I said in an earlier spoiler, local health departments were the most common partners that libraries have in this work, but also nonprofit organizations and as part of broad community coalitions, which likely also include some of you and your colleagues in the NIC community. To collect the data, we spoke with up to 9 individuals representing the library, the partner organization, and community members who engaged in programming or services that the library was offering. Because each location is different in terms of the available staff, there may not have been 9 people to interview, which was expected. We also know that we looked at a lot of libraries that were smaller, and some of them simply didn't have the capacity to participate in our research because it takes so much time and attention. So we like to recognize as well that there are libraries of all sizes doing this work. So I am now going to turn it over to Kendra to dig into the specifics, which I'm sure you've all been waiting for. So thank you for your patience.
Thanks, Lara. And one of the things that Lara was mentioning was that this is work that is happening with libraries of all sizes. We heard it in phone calls and research that we did trying to find individuals and speaking to state libraries who are a big connector for both PLA and OCLC. But because of this project was focusing on partnerships, it limited the responses. And we really wanted to emphasize this, particularly because of the challenges that come along with this topic and the access to subject matter experts in the field. It really is a strong opportunity for libraries to partner with external folks. So what I wanted to spend some time doing is sharing with you some of the programming and service examples that come up in the research that we conducted. And I wanted to start by engaging you a little bit in the question about what word or words come to mind when you hear the word library. And you can use the chat to put in your thoughts. I'm just kind of curious to know what, when you came to today's session, what were you thinking you might hear? What's the first thing that comes to mind when you think about your local library or possibly the library you used in school or in college? Community and books are definitely 2 of the most common ones that we hear, and we do love it when people start with community. That's awesome. And books are such a core part of the services that libraries provide. Access to those resources is just a core mission to libraries to make sure people have access to knowledge and resources. A version of a town square is fantastic. I love that. Tool rentals, free phone use, access to bathrooms, very important in many towns that the libraries provide those safe spaces for people. I am a huge consumer of ebooks at our local library. So whether it's a physical book or a digital book, online resources that I wouldn't be able to get as an individual are all things that I depend on from my local library. So these are great, and it's wonderful to see the diverse examples that you all are providing. So these are just some examples of the types of programming that we found libraries were doing in connection with their partners. And the reason that I wanted to ask you that question about what you think when you hear libraries is that a lot of these examples go beyond what people traditionally think about with public libraries. And our research showed a range of programming and services, and that was intentional, as Lara mentioned. We wanted to show that diversity. It's really important for us that when we provide examples to libraries about the type of work that they might engage in, that we try to find a good starting point for them, that it doesn't have to be something that's overwhelming or a massive program, that we can all take small steps towards serving our patrons in a different way. And that's really important to us. So everything from doing something traditional like a community read and an author talk through something really non-traditional, which is doTERRA drug disposal bags being offered at a library, and that you can walk up and get a bag to safely dispose of the medication in your libraries. So those are almost like lower touch examples, right? Like being able to distribute those bags. And I'll talk more about that program. It's been one of the a really accessible thing that we learned about through this research, and I'll share a little bit more about the library that's doing that work. But there are all kinds of examples and programming that can fit a range of budgets. As I'm sure you are all familiar, you know, budgets are always a concern with libraries. So when we have so many ways that we can connect with the community, sometimes prioritizing that can be a challenge. And there is no one-size-fits-all prescription for how to handle this. Each library is in a different community, and it has different needs, so there's no one-size-fits-all. So the more examples that we can provide and the more diversity in those responses, the better it is for us, and the more we're helping libraries to see a path for themselves. So, and I think both OCLC and PLA really come away from this research understanding that it's important to continue to let libraries choose their path and really give them that starting point through some of these ideas. And we focus on providing access to the information and resources to help inform those local decisions. This is an example, and I'm going to walk through a few of the specifics that we saw in libraries. This is from the Peoria Public Library, which was one of our case study sites. And they have overdose rescue kits, which include doses of Narcan, which is the opioid overdose reversal medication. And this also includes instructions on how to administer the Narcan. We found lots of libraries that were doing Narcan training for their staff. The vast majority of them were doing it on a voluntary basis. So they would invite staff to participate. The most successful programs usually did them a few times to allow people to sometimes warm up to the idea, to get people sometimes hearing from another colleague about what the training was like was helpful, and they'd see an increase in the next session, and just getting to people who may have missed the opportunity to participate on a certain day if they were out. Salt Lake County Library in Utah has a really large display right at their checkout desk of the public library to help community members recognize what an opioid can look like and increase awareness about some of the potential hazards. So this is part of a statewide program called Use Only as Directed, and the library was one of the participants in that program. And it just sparks conversation, right? And the whole point of the campaign was to encourage individuals to talk to their doctors about alternatives to opioids and to really help to inform people about some of the realities. This library also has a really large display when you walk into the main library, and I was fortunate enough to get to go out and do the interviews at this site. But when you walked into the vestibule, you could see 7,000 paper pill bottles hanging from the ceiling of the library, which represented the 7,000 prescriptions for opioids that were filled every day in the state. So it was really impactful because it takes a second to realize what you're looking at, and then you understand it and you start seeing some signage around the library explaining what those pills represent. And again, it's with the intention of encouraging people to have this conversation with their doctors and to understand some of the implications. And these displays were funded entirely by the health department. So the library didn't need to pay for anything, but they did provide the space for the displays, and that was able to greet hundreds of people who walk through the doors of the library to learn about the epidemic. So it was a really subtle but engaging way to share information with the public. This is the New Orleans Public Library, and I really loved the program that they rolled out. It was called Bystander Training, and they did this again in partnership with the local health department, and people learn how to use naloxone plus how to perform CPR and a program called Stop the Bleed, which is for traumatic injuries. And this approach of including overdose reversal training with other common health concerns really helps to reduce the stigma of understanding how to use naloxone and the circumstances when it might be helpful. And it gives the trainers an opportunity to introduce some facts about substance use disorder and to help introduce people to the idea. And the health department provides all of the trainers for these events, and both organizations help to promote the training. So the library schedules the events in different locations throughout their system to help reach more community members. And I thought it was such a powerful way to take a topic that is sometimes very stigmatized and combine it with things that we now accept as being important to know, addressing traumatic injury, using CPR, and just making it part of a common conversation. This is at the Blount County Public Library in Tennessee, and the staff here work in partnership with Recovery Court in Blount County to provide training on a variety of topics at the public library. So this program to me is just so amazing. The library director was at a meeting with staff from Recovery Court, and her question to the Recovery Court staff was, how can we help you? And the Recovery Court staff member said, we really need help with our life skills curriculum. And the life skills curriculum includes things like cooking, health, basic health care, finances, job interviews, and they were all things that the library was engaged in with the broader community already. And the library director there was just fully committed to the idea that this aligned with the goals and the mission of the library and supporting the community. And the program has just been remarkably successful. All of the Recovery Court participants come to the library to participate in the training. The library is constantly evolving the curriculum in order to be able to adjust to feedback that they get from the Recovery Court participants. And it's just a really valuable way to partner in the community with the strengths that the library has, including access to those computers, to trainers, and informational resources. I mentioned these doTERRA drug deactivation bags earlier, and this is the Twinsburg Public Library in Ohio, and they are part of the Summit County Community Partnership in Summit County, which is where the library is located. And medication disposal is a preventative measure that is being taken by some libraries. One aspect is, removing unused medication from the home so they can't be misused by individuals. And these bags are available in the library. Individuals can just walk in and ask for a bag, and then they can put any unwanted pills into the pouch with water, seal it, and being able to dispose of it safely. Another common alignment is with drug take-back days. So Salt Lake County promotes that, and they promote the availability of drug take-back collection boxes throughout the county so that people can make sure that that opioids are not left in the home when they're no longer needed, which can help to prevent abuse. So as you might imagine from all the examples I just covered and the work that was done, that the libraries and their partners identified some important key outputs that resulted from the opioid response activities. The most commonly mentioned output was an increase in the number of resources available for the community, which is something that the library is always interested in doing. How can we connect the community with more information? These resources included things like naloxone kits. Salt Lake County, you can actually walk in as a community member and request 2 doses of naloxone and leave with those doses. They have them at the checkout desk and you can take those with you. The distribution of books, so books like Dreamland by John Quinones was a really popular read, but there are others. David Sheff wrote a book called Beautiful Boy, and a lot of libraries would buy multiple copies of that book and then have a community reads program deployed. And other key outputs were the development of these new partnerships, reaching other libraries and community organizations. And a really important aspect that the libraries and their partners addressed was the importance of addressing the stigma with substance use disorder. So the 2 key opportunities that surfaced when we asked people about what work still needed to be done as part of the case studies. The first was stigma, and it was mentioned by both library staff and partners. And this was a concern. There was a concern by library staff as they deployed some of these programs about the perception that there may be in the community around providing opioid-related programming or substance use disorder programming. And that surfaced both with concerns about how the community would react as well as the library staff. So we all have an opportunity to learn more and to be better informed about the realities around how stigma can impact individuals from both seeking treatment, asking for help for the individuals who need to find support in their community because they have a loved one who is suffering. There's so much connected to the stigma issue, and it was very clearly identified as one of the concerns. And the second concern won't surprise you, and I'm sure many of you deal with this in your own work, but that was the funding to be able to do more. They needed more access to books and resources. They needed more trainers to be able to do training. They wanted access to more peer navigators to connect to the community. Nobody said that they had enough. They saw that the need was there and they wanted to be able to do more to support the community. So this is something that, you know, I don't know if there's a single thing that we do in library land where funding doesn't come up as a potential concern. It's something that's challenging, but we do encourage, especially in the library field, looking to connect with partners can help to increase some of the capacity and help us share the load. So I wanted to transition to talking about the most recent publication. And before I do that, though, I could pause to see if there were any questions about the types of programs that are happening in libraries before I move into the call to action work. I haven't seen anything come through. I know we've been sharing a few links.
Kendra, I have a question about, this is Daniel, about preparing the staff or working with the staff in the libraries on pretty technical content, and how you, or how the different groups did that.
Yeah.
As a way to, as a model for thinking about how else you could expand this.
Yeah, that's a great question. So Kalamazoo Public Library in Michigan launched a program in partnership with the Southwest Michigan Recovery Institute to bring peer navigators into the library. And peer navigators are often individuals with lived experience who can help connect people to social services that might be in the community. Sometimes they're just somebody that you can talk to who may have lived experience and be able to relate more closely to the topic that an individual is struggling with. And in Kalamazoo, one of the things they did was to host a program that they call the KPL Academy. And that is their training program that they do for staff. And in that case, they brought in peer navigators to talk during a presentation about the type of work that they do, examples of how they talk to individuals who are in the library. In that case, right, they were going to be coming in and introducing themselves to people and say, hey, my name's John. Is there anything I can help you with today? And kind of setting up some expectation about what the peer navigators could do and providing clarification to the public library staff around the role that they can play and how they can help support the needs of some of the patrons there. So doing staff training is definitely a key part of that. And it's something that we encourage, and it's a big part of the work that both PLA and OCLC do, which is, helping to make library staff more comfortable with new topics and addressing new challenges in their community through continuing education. But in almost all of the cases, this leadership at the library were definitely introducing topics, letting people know what's coming, helping to build that buy-in around new programs and services that were being introduced and that would be impacting the delivery of services within the library.
Cool.
Hey, Kendra, two things I'd like to add is, and we'll touch on this in the call to action, is that this was also a big deal with our partners to be the subject matter experts to do that kind of technical training. So that is one of the things that we saw a lot of and that made a ton of sense in terms of the technical training. So that is a role that those of you in public health can really contribute. And the other thing, in case folks are not aware, in Denver Public Library, for instance, a lot of the work is happening and being coordinated through a library-based social worker, and that's something that we're also seeing in public libraries, is that in many cases they are adding social workers to their professional staff to play these kinds of roles, either in coordination or training, and obviously with referrals. So those are two things, both on the partnership side and in terms of our staffing, and a trend that we're seeing in libraries, particularly larger urban libraries, but not limited to that community, that's making a real difference.
So Nora just asked a question if there's been any pushback from parents in any of these communities who use the library for children's activities. And we know that those concerns have surfaced. The director of the Denver Public Library has talked publicly about having to balance that need of serving everyone in the community and making sure that it's still a safe space. So it is absolutely coming up, and it is part of the conversations that libraries are having both with their local government as well as the library staff on how best to approach some of the safety issues.
Interesting. One follow-up question before we jump in terms of dissemination, is it library to sort of subject matter expert to individual libraries, or is there a mechanism now that actually enables that distribution across the library system or systems in a way that could actually sort of expedite the replication of that knowledge or that information?
I would say it really differs depending on the number of libraries that are in a system. Most libraries are standalone single buildings in smaller rural locations that serve less than 25,000 people. Represent the most number of individual buildings. But of course, in a large urban library or even a large county library where they benefit from shared resources, there can certainly be an advantage there to being able to capitalize on some of the strengths that providing district-wide training, county-wide training, whatever, system-wide training, whatever it may be. And we also know that some state libraries have been taking initiative to provide direct support to library staff through grants to do some training. And I'll talk about the mental health first aid training that's been happening in some places. But it really varies. There are as many different governance structures for libraries as you could possibly imagine. So, and they all work a little bit differently. So it can depend greatly.
Great, thanks.
Right. So we'll talk a little bit about our recently published call to action. And we shared the link for this. All of the resources for the project are on that single website, and we'll go ahead and post that in one more time. But the call to action is the culmination of this grant-funded project, and it highlights the ways for libraries to engage on this topic. As we glean from the case study research and the discussions with public health and human services organizations, nonprofits, library support organizations, and government agencies. So it's how we came to the feedback that we put into the call to action report, which was really designed for libraries to take and then take the next steps, like to read through the call to action, take the next steps. We are also working on developing a resource for individuals who are interested in partnering with libraries and organizations to help share some of the information that we're putting out here to all of you, but in a flyer-based format to kind of pique people's interest in reaching out to libraries. So we did a total of those 8 case studies. We took the learnings from that. We took the learnings from the cross-sector discussions that we had in the fall, which is where we got connected with Nick. And this is a freely available report. You are welcome to distribute it to your communities, and you can access all of those resources on the site. I wanted to walk through the 5 steps that we've outlined just to give you a sense of what we included. I think that this speaks to a lot of different fields. The language we use may be slightly different because it's specific to libraries, but even the content, when we think about how to approach this, so much of this is connected to how we might approach any type of public health concern or issue in the community. So a lot of it now applies to ways that we might be able to help around the COVID-19 crisis and the steps that we might want to take to better understand the role that libraries can potentially play. So I'll walk through each of the 5 steps. The first is just exploring community data. I love data. I love looking at data. Lara has spent a lot of her career collecting and analyzing data. It's just really helpful for us. We have access, of course, through the county health rankings, which is a national data set that's available. We share a lot. Lara and I depend a lot on data that comes from the Institute of Museum and Library Services about how libraries function. So they collect data every year from public libraries, which is how we know how many library buildings there are. It's how we know how many programs are being offered, the budgets in libraries, and that is a really great set of data for us to help share back information to encourage investments in libraries and to show the reach. So that's something I'd be happy to talk more about going forward, if any of you are interested in understanding how that IMLS data works. But county health rankings, I'm sure, is something many of you are familiar with. It's just super valuable in terms of the content that's available there down to the county level. We also encourage people to connect with their community assets by doing a community mapping process if it works for them. There was a great toolkit that came out of Canada called the Community-Led Libraries Toolkit, and they lay out a process for understanding who your local partners are, how to make those connections. We benefit from a field that is really very collaborative and interested in sharing. Library land is a very giving community. People like to be able to share what they have and try and avoid reinventing the wheel. So for us, being able to promote these existing resources and approaches is really helpful to that community. But we encourage libraries to seek a seat of the table. I will say that of the 8 case studies that we did with the partnerships, it was the libraries that made the connection in every case. It was the library that was reaching out to say, hey, we could do this, or what could we do for you? Or, hey, I saw you were offering this somewhere else. Do you want to try and do it at the library? So we'd love to see that flip a little bit and see more people reaching out to libraries and asking. We can't speak for libraries in terms of what they might be able to offer, but reaching out and trying to find out if there is an alignment between your needs and what the library can offer is a great place to start. So we have a poll question, and let's see if we can get it to come up this time. Fantastic. So this is a multiple choice question, but when you think about the needs of your organization and how they might align, what are your greatest needs? Is it community space, marketing, access to good partners, disseminating information? You can click as many as are relevant, and you can also enter any other ideas into the chat as well. I'd be interested to know what else is on your minds in terms of your needs around this issue or connecting with partners. Right.
Usually takes a few minutes for people to
Yeah.
their thoughts there.
We have 43% votes so far.
See if we can get it to 50. Good representative sample.
Yeah. Yeah, I'd be curious to know what we're missing too, if there's other things that are helpful to hear about in chat that come to mind around how your organization is trying to reach out to the community or engage with individuals.
We have 50%. 52,
Great.
54.
All right.
Good?
Good.
Okay.
And are you able to display the results on this?
Yes, I just did. Do you see them?
Not yet. There is another button at the bottom that says display. Do you see that? Is that showing up for you? On the poll itself. Share
Yes.
results.
It shows that it's sharing the results. So maybe I can tell you just the percentages.
Sure.
So for the first option, it's 29%. The second option, 68%. The third, 39%. And the fourth, 46%.
Okay, so marketing reach to diverse communities was the highest need.
Exactly,
Yep.
yes.
Okay, great. So when we think about the strengths of libraries, these are some of the things that we know from our work that libraries can absolutely bring. And, you know, for Lara and I, our organizations are all about supporting the value of libraries, and not just in our communities, but with stakeholders and funders and potential partners. And these are some of the strengths that libraries do bring to partnerships. And we encourage you, as you look at opportunities to connect with libraries, that you also consider the strengths that you can say your organization can bring to any situation. And this goes beyond the opioid crisis, of course. It's partnerships of any kind. And anytime we can approach these relationships, we need to be able to be clear on the strengths of our respective organizations. Oops, that's in the wrong order. But so the next one that I want to talk about is increasing awareness and knowledge of the issue among staff and the community. So this goes a little bit back to the idea of helping to reduce stigma around the topic, and the question earlier about how do we help prepare library staff, right? We have to be responsible for providing accurate information to staff so that they can pass that on, and helping to increase understanding around the crisis. So, libraries connect people to information on a range of health topics. And if we take out the stigma that is often associated with substance use disorder, it is still at its core a health topic that we have tremendous access to credible, reliable information, and we can use that to both increase the knowledge of staff and the community. One of the ways that libraries have been doing this, there's been a lot of conversation around trauma-informed care, and that is becoming more common of a discussion in libraries as the social workers have become more common, that Lara was mentioning. So we have library staff in that. We have a social workers in libraries interest group that's hosted by PLA, and they have offered webinars to library staff about understanding trauma-informed care, which is really helpful, to open up the broader picture about what it can mean sometimes in libraries to provide services to individuals who are in crisis. And then the other big program that has come up a lot in libraries is mental health first aid. And one example of this is in Ohio. They took federal funding that they had received and offered grants throughout the state for libraries to host mental health first aid training. And this is such a great program. It's a 2-day face-to-face training. I know that they're working on developing online content, which will be timely because I think people are really going to need it. And what I think is particularly helpful about that content is that it helps us in both our professional and our personal lives. So if you haven't seen that program, it's something I encourage you to check out. It's remarkably affordable in many cities to jump onto an existing training program. But we also know that libraries are getting individuals trained as trainers, or someone in their county is becoming trained as a certified trainer in that program. And it is a great way to help increase awareness around a variety of issues that can connect back to the opioid crisis. So it's something that we've been promoting. We shared a lot about it in a December webinar that we did with the library community as well. And then it's a huge part of it is connecting people to the facts, right? Making sure that folks know, that 12 to 17-year-olds who misuse prescription opioids got them from a friend or relative, right? Helping to make the case for safety, drug disposal programs, drug take-back programs, and helping to increase understanding about how some of these issues may develop and what we can do to help with prevention. Focusing on staff care is a really important aspect for the work that we do, again, both at OCLC and PLA, acknowledging compassion fatigue, which is, if you haven't heard this term before, but it's recognized by the American Institute of Stress as the emotional residue of strain of exposure to working with those suffering from the consequences of traumatic events. And it differs from burnout, but can coexist. And compassion fatigue is an issue for library staff that surfaces on a variety of topics. We saw it a lot during the Great Recession. Library staff were helping people locate information related to filing for unemployment, for public assistance programs, housing options, job seeking. And it's certainly not a phenomenon that is exclusive to library staff, but I think sometimes people are surprised to hear that it impacts library staff, but it's really important to us to acknowledge it and to make sure that staff know that we hear that concern and that we look for ways to both address it and be prepared to deal with issues that may arise among staff. We encourage people to create a post-crisis plan if something traumatic happens at the library. And again, this is not exclusive to opioids. It could be on a variety of issues. We know that there are sometimes violence, overdoses, any type of potentially traumatic event. We encourage people to think about the resources in their community that they can connect with, including for those who may have access to an employee assistance program through their insurance, is just knowing what resources might be available before something traumatic happens. And the last step that we encourage libraries to look at is the opportunity to do engagement in programming. And this connects back to some of the examples that I shared earlier, providing space for recovery meetings, updating the library's website with resources, distributing free pamphlets. You know, a lot of this is core library services around connecting people to healthy communities and healthy outcomes. How do we help improve those social determinants of health through libraries? And there are really some fantastic groups in library land that support this topic. We have colleagues that run a program called Let's Move in Libraries, and his whole commitment is to make sure that he elevates, this is Dr. Noah Lenstra out of North Carolina, but he just wants to elevate the role that libraries are playing around healthy communities. And it's really, you know, for us to focus on one topic, it's not unusual. Every now and then something floats to the top. Lara's been doing a lot of work on the census and showing how libraries can support it. So engagement in programming is just core to what we do. And in this case, we're encouraging people to remember that substance use disorder and the impacts of that on the community are something that they can help to support. We asked interviewees, you know, about the research, and this was one of the things that really stood out to me. And I was really fortunate to be able to go out and do some of these interviews face to face with the participants in the research. And I will tell you, it was really impactful to me. I cried during some of those interviews. We had an opportunity to speak to members of the public who had utilized services at the library. We talked to partners who were just so impressed and appreciative of the efforts that libraries were bringing to addressing this issue in the community, and the library staff themselves who truly saw a need in the community for this type of response, and that the library had a role to play. And for us, this is something we've tried to share in all of our presentations, but that this study, the work that we've done, is just proof that this is something that we need to do. It may be a small step, but we need everyone to take a step in helping to serve the community on this issue. So that's all the content that we have. I'm really appreciate, I saw lots of folks sharing some resources, and Lara and our colleague Mercy is also here sharing a few resources as well. Thank you, Mercy. But I'm curious if you have other questions, anything that we can help to address or discuss.
Thank you, Kendra. That was great. I have some questions, but I'm going to wait for a minute to let people jump in if there's some thoughts or questions or responses before I hog the mic. TikTok. So one of the things that I know we had talked about this earlier when we discovered the amazing work you guys were doing and the online groups you were holding. They were absolutely amazing. I don't know if you've actually made those available, but I tell you, I've done a lot of online work. You guys are so expert at bringing conversations to life. I found them incredibly valuable. So it was quite something. And I encourage people who are in the topic, involved in the topic, to carefully look at their materials. They just produce brilliant stuff, and it's very accessible and readable and useful, which is, I guess, to be expected from a library, affiliated with libraries. It goes without saying there. One of the things I was really fascinated with when we were talking a while ago was the dissemination and distribution opportunities through libraries. As you were describing it, as I was first getting oriented towards it, one of the things that struck me was, boy, we have so many messages, and you articulated some of them here, even around social determinants, some of the very aspects of not only resources, but information and knowledge and education around this. I know it's not a single system that you can just sort of push stuff out to, but I'd be curious, especially now in terms of COVID-19 and all the misinformation that's getting spun up, as we go forward, and just as an example, can you talk a little bit, just a bit about sort of how that stuff gets disseminated across that giant network across the country?
Yeah, we have a couple of big channels. So our respective organizations do a lot. I mean, ALA and PLA are just our largest professional organizations and with very large memberships. And so they are huge for being able to share information, and Lara can speak more to that. So we have our professional organizations and a very active online community in general. Like there are groups for all kinds of things in libraries, from youth services to healthcare to small business development groups. Like there's a lot going on. We also have state libraries. So every state has a designated state library that administers federal funds, and what they do varies greatly, but they do sometimes work in partnerships with organizations to push out information. But it is so different in terms of the capacity that they have at the state level to do that. So while there are multiple streams for sure, there is no one way to get to every public library in the country. It's just not possible. There are over 9,000 library systems and 17,000 buildings. So we don't have a unified communication method, but we do have folks who do reach a very large portion. And Lara, do you have anything to add to that?
No, just to reiterate that it's something that a lot of times folks will come to the ALA or PLA and ask about it, and that's absolutely true. 85 to 86% of public library funding is local at the city or county level, and their jurisdictions are at the local level. So our membership, for instance, is not an enforcement body, it's an opt-in, like the Dental Association or some other professional organization. So we have a huge reach along with OCLC and other colleagues in this space. But it's true that if any of you are working at the state level, the state library agencies are the most likely to have reach into every library in their state in terms of communicating everything kind of comprehensively. And we do a lot of work with the state library agencies and their national organization as well. But it's true, it is a little fractured. The good news is that your local library really is responding to the needs in your local community in a very close way. The bad news is there's not a ton of uniformity, even though there's shared code of ethics and all of that kind of stuff. So that, I would just say what Kendra said. It's a challenge, and also wonderful when you see how awesome libraries can be and what they're doing locally.
Yeah. I see a couple other questions from James about whether or not library access to naloxone is an effective strategy for reaching people who use drugs and opioids or reaching family and friends. I think the message that we have heard from libraries, and there's kind of two separate issues, right? So there's access that the staff has had to training to be, to feel confident, to be able to respond to a crisis. And I would say two of the libraries that we had done case studies at that had trained the staff in naloxone, when we started the research, they had not had to use it. No one had had to use naloxone. And by last December, two additional libraries had to use it at one of their locations. So in terms of a strategy for reaching who use opioids, I think it's a strategy to save a life. And that is what the libraries are seeing. And if they can take that opportunity, they're going to do it. But like I said, it is still fraught with some concern and stigma around making that available, in terms of concern around is that going to encourage more drug use in the library? There is no library that condones drug use within their facilities, but it does happen. So there is concern around that and the impact. We do not think that that's happening, but it's certainly part of the conversation. And then for the libraries that are distributing naloxone or doing training for the public, in New Orleans, the interviewees that we talked to just felt like they were more confident. They had the opportunity now to save a life if the opportunity arose. Like they knew how it worked and what to look for. And they didn't want to find themselves in a situation where they wish they had been able to do something but didn't. And that is awareness building, I think, at its best, where you're giving people a choice to take action. And then I see a question from Brett on one of the last slides about the genes people are born with account for half a person's risk for addiction, and if there's more evidence that libraries are highlighting regarding this connection. I don't have any evidence of that. It's one of the, if we think about facts that we're sharing to help overcome stigma around, you know, who is experiencing substance use disorder and why they truly deserve our compassion and support and understanding, is that some of this does start to become out of our control. For some people, like they were just at a greater risk for addiction and the circumstances led them there. And if we can help to explain some of that to individuals and create some compassion around people who need our help, I hope that is part of the conversation. But it's really more to say there's more to this than, you know, someone misusing drugs of any kind. Then they're bad people. Like it's not the be all end all of the conversation. There are many things that we need to take into account, and that's just one of the factors. And let's see, virtual services. We were talking about policies libraries may have to provide Wi-Fi hotspots for telehealth or other virtual services during COVID-19. That's a great one, Lara. Have you seen anybody doing that right now in the research?
Oh, I love it when people ask me questions that I know the answer to. What we are seeing is that libraries have been doing work with hotspots actually before the COVID-19 crisis, because it's moving so quickly. It's actually hard to get new hotspots, but we have a survey out that we're getting ready to close now, and we ask about this. And I would say it's less than a majority of libraries, but there are many that are lending hotspots, and I think they've become really, really important right now. The other thing that we're seeing that libraries are doing, and this is a majority, is that they're leaving their Wi-Fi on, and some of them are promoting this and saying, hey, you can use our public Wi-Fi in our parking lot, for instance, and we see a lot of that kind of activity. So those are both things that we're seeing that libraries are doing, and the hotspots have become like a really big question and desire to add more, and we've kind of run out. We've run out of them at the moment, yeah. So we're working on that.
Yeah.
So thank you very much. We're just want to make sure that we just have a couple minutes here before the end of the session, and people run off to their next webinar. But I do want to deeply thank you for the work that you have done, and how clearly you've been able to present it, and how encouraging and exciting it is to this community. I think I'm interested in challenging some of our architects and some of the technical people about how we can help make the interoperability connection between all the libraries, because it seems like a wonderful opportunity to be able to share more broadly across the country. See what we can do with that as we go forward. So again, thank you very much. We will be posting all of the materials. This video will be posted online, and we invite you to share additional questions, and hopefully Laura and Kendra will be available to answer questions as we go onto the hub and post some of that there. This stuff will live there for a while. So thank you for that. Just a couple of other details before we close up here. As I said, we have a series of sessions coming over the next couple of weeks, and some of it will be speaking about the WIN network, the well-being in the nation. This is fascinating work, really trying to create national metrics and measures for measuring social determinants and creating a standard across the country. So tune into that. And as I said, if you're signed up for the hub, you'll be getting notifications for that. Just two other things. One is last year as I mentioned, in our work, we actually developed a playbook on opioids more from a system level perspective. And there's 11 plays on that. And that's also a resource for those of you who are interested in this topic. If you haven't seen that yet, we'll be posting a link to that, and it has a lot of different information looking at different also use cases from across the country. So that's also available on the various hubs there. And then finally, what I would ask for folks, I'm not sure if it's on the next slide or not. Keep going, one more. Yeah. So we've periodically asked for some feedback on the work we're doing here on the NIC, and that link, which Sundays will put into the announcement here. For those of you who have a few minutes before we finish up here, go ahead and click on that, and there's just 10 questions there. Would be very helpful as we look to design, redesign, and tailor these sessions and the work that we're doing going forward, to hear from you about what's important, how you'd like to be involved, any suggestions we have on that. So go ahead and click on that link. And I just want to also thank many of our partners and members here, in particular, calling out Iris Health Solutions and Alexandria Consulting and Interoperability Institute, who are helping us with the proof of concept that we didn't talk about today at all, but we've got a project to try to demonstrate data sharing between health, human services, public health, schools. That fundamental structure of how do you share information in an effective way is in many ways underlying the kind of social determinant work that many people are involved with from very different areas. And so I, again, encourage you, as you have time, to go onto the NIC site, look at some of those things, track us as you're going, and if you're interested and have time to participate in some ways, we really welcome your participation in that. So with that, I want to thank everybody again for coming. We'll see you not next week, but the following week. And again, really deep thanks to Laura and Kendra for your excellent work, and look forward to tracking you as you go forward and supporting it. I will just, the last sentence I said is, a couple of weeks we're going to have the Agents for Healthcare Resources on, talking about very detailed clinical studies on opioids. And that might be something that if you have time to join us on with your perspective, and or see if we can make a link. I know that they were incredibly interested in the work you were doing. As a federal research agency that's really got, developing the evidence for this stuff, they were excited about the opportunity. They had no idea that the network existed, and the opportunity to disseminate that kind of knowledge and learning in the community got them really excited about it. So if we haven't made those connections yet, I'd love to make that available to them and you to them and that kind of stuff. So thank you all. Have a great, safe weekend, and we'll see you back here soon. Okay, thanks everyone.